Hi, good morning all. Today we see about acid-base imbalances. In this section, I teach you about what are the different respiratory acidosis, respiratory alkalosis, and metabolic acidosis and metabolic alkalosis, its features and is as well as the management. First, we see the acid-base imbalances. Here, when you see the blood pH level less than 7.35, then we say it's a acidosis. Okay, that is blood pH level less than 7.35. As you know, the normal pH level is 7.35 to 7.45. And when the blood pH level is more than 7.45, then it is a state of alkalosis. The body responds to acid-base imbalance, that is we call compensation. As you know, any kind of physiological change happens in our body, definitely the body mechanisms as it is our central nervous system or otherwise the endocrine, that is a master glands and all that will automatically try to compensate, rather try to normalize the situation. That is a state we used to say, that is a compensation stage. Then, so through the compensation, it may be complete if brought back with the normal limits. And partial compensation is if range is still outside the normal situation, then we say that is a partial compensation. Then we see what is a compensation. If underlying problem is metabolic, hyperventilation or hyperventilation, so that is a respiratory compensation. That is a respiratory system will activate to compensate the situation, otherwise activate to normalize the situation. Then, so if the problem is respiratory, renal mechanism, then metabolic compensation will functions. And we see this is the overall view of acidosis. The acidosis in the sense, there's a principal effect of acidosis is depression of central nervous system through decrease in synaptic transmission. So here patients seem generalized weakness, deranged CNS function, the greatest threat, and the severe acidosis causes disorientation, coma, and death. And see what is alkalosis and how it affects. Alkalosis causes overexcitability of the central and peripheral nervous system. So seems numbness, lightheadedness, and it can cause nervousness, muscle spasms or tetany, convulsions, loss of consciousness, and further if you are not treating, end up with the death. Here we see what the imbalance happens in acidosis as well as alkalosis. If you take acidosis, there is accumulation of acids and as well as the loss of base. Accumulation of acid and loss of base, there is an increased concentration of H plus ions. When there is an increased H plus ions, there is a decreases the pH level, that is pH drops. That leads to acidosis. Okay, that is accumulation of acids as well as loss of base. That will lead to what? Increase the concentration of H plus ions. When H plus ions increases, the pH will be decreases. That is a state we say that is acidosis. On the other hand, when there is a loss of acids and accumulation of base, there is decreased concentration of H plus, that is decreased H plus ions. That leads to increases the pH level. The state we call alkalosis. Then see what is respiratory acidosis. In respiratory acidosis, the carbonic acid excess caused by blood levels of carbon dioxide above 45 mmHg. As we know, the partial carbon dioxide level in blood is 35 to 45 mmHg. When the carbon dioxide level exceeds more than 45 mmHg, there is carbonic acid excess. So similarly, hypercapnia. When there is hypercapnia, there is a high level of carbon dioxide in blood. The chronic conditions that leads to respiratory acidosis are depression of respiratory center in brain that controls breathing rate, or certain drugs or head trauma. Then paralysis of respiratory and chest muscles and emphysema. In these situations, there is a excess of carbon dioxide in the blood. Then acute conditions like adult respiratory distress syndrome, otherwise acute respiratory distress syndrome, we used to say patient with the ARDS and pulmonary edema and pneumothorax. In these situations also, there is a change in the respiration. Carbon dioxide will be stay back in the blood. That leads to hypercapnia. Here we see what are the conditions or the situation that leads to excess carbon dioxide trapping. So conditions in which there is a depression or suppression of respiration. So when there is a change in the respiratory center function, there is a alteration in the gas exchange. The conditions like damage to central nervous system, maybe any conditions, I mean, or head injury or maybe any type of trauma. So there is or any decreased perfusion, there is a cerebrovascular accident. So all these situations when there is a damage to central nervous system, so respiratory center will be affected. So normal gas exchange will not be taking place and carbon dioxide will be trapped in the blood itself. The loss of ventilatory functions and as well as effect of pain. Second one is a condition causing impairment of diffusion of carbon dioxide across alveolar membrane. So damage to the situations or the condition that leads to damage to the alveolar membrane. The conditions like emphysema and pulmonary edema. Then the conditions in which there is an obstacle to escape of carbon dioxide from the alveoli. So usually in the gas exchange, oxygen will take over to the capillaries, then carbon dioxide will be removed through the our lungs. So the situations when there no way for carbon dioxide to move out, there is laryngeal obstruction and asthma. There is a obstructive lung diseases that leads to that will prevent the escape of carbon dioxide from the alveoli. And the conditions which pulmonary blood flow is insufficient, that is especially congenital heart disease and all, there is a decreased oxygen transport, otherwise decreased blood circulation throughout, and that will prevent the gas exchange. Then compensation of respiratory acidosis, that is kidneys eliminate hydrogen ion and retain the bicarbonate ion. You can see that one in this picturization. In the first picture you can see that that is a first aspect is a metabolic balance before the acidosis, that is you can see 1:20, that is ratio is the that is H2CO3, that is carbonic acid and bicarbonate ion, that is in the balancing state, that is 1:20 in the state. So when there is acidosis means what happens, there is a breathing is suppressed and holding carbon dioxide in the body, otherwise carbon dioxide is staying back in the blood itself. So what happens, there is a carbonic acid level increases, so it comes doubles, right? Carbonic acid level increases, so when there is a weightage to the carbonic acid level increase, so the bicarbonate ions also, and there is a compensation, otherwise the ratio is not equal, so there is an imbalance happens. So what happens, the primary changes are pH will be decreases, partial carbon dioxide level will be increased, and bicarbonate, there is no change in the bicarbonate level. Then when there is a third aspect is a body compensation, there is a body try to compensate. What it does, the kidney will function, so body's correction stage in the sense that is a carbonic acid. So decrease acidic urine, that is kidneys conserve bicarbonate ions and eliminate H plus ions in the acidic urine. So when there is, it will increase the to compensate, what it does, it increases the quantity of carbonic or bicarbonate ions. Okay, the ratio you can identify. Here is a doubles and here it is actually it is a 20, it is increased to 30. So trying, the body is trying to compensate that. So therapy required to restore metabolic balance, that is to make it to the balancing level, we administer lactate solution, that is lactate solution used to treat convert to bicarbonate ions in the liver. This is what the compensate, rather is the what is the process exactly happens in the state of respiratory acidosis. The signs and symptoms are, in the respiratory system, there is patient has dyspnea, respiratory distress or shallow respiration. Then respiratory rate will be, that is tachypnea will be there and gradually depressed. Then in the nervous system, patient have headache, restlessness, confusion, lethargy and disorientation, tremors, convulsion and even coma. Then if carbon dioxide level extremely high, drowsiness and unresponsiveness will be there. And cardiovascular system, patient have the symptoms of tachycardia and dysarrhythmia. And the skin will be warm and flushed due to vasodilation caused by excessive carbon dioxide. These are the main clinical features of respiratory acidosis. Then management, how to treat respiratory acidosis. So first of all, restore the ventilation. There is already we seen what are the causes or what are the factors that interfere with the carbon dioxide exchange. So identify the particular factor and we are supposed to restore the ventilation. Then intravenous lactate solution. Then treat underlying dysfunction or the disease. Then next condition is the respiratory alkalosis. What is respiratory alkalosis? That is carbonic acid deficit. So partial carbon dioxide less than 35 mmHg. As we know, the normal carbon dioxide, that is partial carbon dioxide level is 35 to 45. When it is more than 45, we say respiratory acidosis, and that is hypercapnia stage. Here, when the partial carbon dioxide level is less than 35 millimeter per mercury level, and that is hypocapnic stage. This is the most common acid-base imbalance. The primary cause for respiratory alkalosis is hyperventilation. When there is a hyperventilation, more carbon dioxide will be eliminated from the body. That leads to hypocapnia. Then respiratory alkalosis, the conditions that stimulate respiratory center, the main causes are oxygen deficiency at a high altitude. There is those who climb the hills and that those who move with the high altitude levels, they have the oxygen deficiency. Then pulmonary disease and congestive heart failure that caused by hypoxia, acute anxiety, fever, anemia, early salicylate intoxication, liver cirrhosis and gram-negative sepsis. Then stimulation of respiratory center, central nervous system disease, salicylate poisoning, hyperpyrexia. Then other features, other causes are hysteria, high altitude effect, use of respirators and hepatic coma. Then compensation of respiratory alkalosis. The kidneys conserve the hydrogen ion. It is just opposite to what we seen in the respiratory acidosis. Here the kidneys conserve the hydrogen ion and excrete the bicarbonate ion. The signs and symptoms includes central nervous system. The patient have lightheadedness, numbness, tingling, confusion, inability to concentrate and blurred vision. And the cardiac system, patient have dysarrhythmia and palpitation, and dry mouth and diaphoresis, and patient have the complaint of tetany. This is the compensatory mechanism, like what happens there. Usually the first section, the first picture shows it is a normal metabolic balance. That is, before that there is a carbonic acid and a bicarbonate ion. That is the ratio is 1:20. So when there is a respiratory alkalosis, what happens? Already said, hyperactive breathing, blow off the carbon dioxide. So more carbon dioxide will be escaped from the blood. So decreased carbon dioxide level. So what happens here? Primary changes are pH will be increased, PCO2 level decreases, and bicarbonate level there is no change. So that is what, as it is 1:20 ratio, here comes that is the decreasing the carbon dioxide level and pH increases. So carbonic acid level decrease. Okay. So as it is bicarbonate level is normal. When the body compensates, what happens? Body try to reduce the level of bicarbonate ions. So in the kidney conserve H plus ions, that is hydrogen ions will be conserved and eliminate the bicarbonate ion. That is then it will secrete the alkaline urine. Okay. So in the ratio you can see 0.5, that is a from the 20 it reduced to 15. So trying to compensate the situation. Finally, the treatment for this is we have to administer chloride containing solution. Bicarbonate ions are replaced by chloride ions. So how they manage the respiratory alkalosis. Next is the metabolic acidosis. Metabolic acidosis, here the bicarbonate deficit. Blood concentration of bicarbonate level drops below the 22 milliequivalent per liter. As we all know, the normal bicarbonate level is 22 to 26 milliequivalent per liter. So here the metabolic acidosis, the change comes in the bicarbonate level. So bicarbonate deficit, then when it's dropped down 22 milliequivalent per liter, that is we call as metabolic acidosis. The main causes are loss of bicarbonate through diarrhea or renal dysfunction, accumulation of acids, that is lactic acid or ketones, and failure of kidney to excrete H plus ions. Then major causes are exogenous production of acid ions, especially in case of diabetic acidosis, lactic acidosis, starvation, high fever, and violent exercise, shock, hemorrhage, anoxia. And next is ingestion of acidifying salt, that is dietary or iatrogenic acetyl salicylic acid, renal insufficiency to excrete H plus ions, that is acid, that is renal in case of renal failure, and abnormal loss of bicarbonate by diarrhea and fistula. These are the common causes of metabolic acidosis. Then what are the clinical features of metabolic acidosis? The patients will be presented with headache, lethargy, nausea, vomiting, and diarrhea. Patient ultimately seen with coma. If you are not correcting on time, end up with coma and death. Other state is confusion, dull headache, decreased activities. Then signs and symptoms of hyperkalemia, that is abdominal cramps, diarrhea, muscle weakness, and EKG in the sense ECG changes, that is electrocardiogram changes, and hypotension. Kusumal's respiration, that is the abnormal respiration you can assess. Then patient seems as lethargy, warm and dry skin. So what is the compensation of metabolic acidosis? So to compensate the metabolic acidosis, it is a increased ventilation. The respiratory system will act on it. When respiratory system act on it, there is a increased ventilation and renal excretion of hydrogen ions if possible, and potassium exchange with the excess hydrogen ion in extracellular fluid. So this is what the management. There is a metabolic acidosis. There is the first section, it is a normal state, that is carbonic acid as well as a bicarbonate concentration ratio is 1:20. So in the next stage, when develops metabolic acidosis, that is bicarbonate ions decreases because of excess presence of ketones, chlorides, or organic acid ions, that is bicarbonate ions decreases. So we can see the ratio. That is this carbonic acid level is normal, but the from 20 the bicarbonate ion decreased to 10. So what is the primary changes? The primary changes are pH will be decreased, partial carbon dioxide level no change, whereas the bicarbonate that is decreased. Then body compensation is hyperactive breathing to blow off carbon dioxide. So because of that, what happens here? That is they're trying to reduce the carbonic acid. So kidneys conserve bicarbonate and eliminate the H plus ions in acidic urine. Then treatment. The treatment option is lactate containing solution. That is lactate containing solution used in therapy to convert it to bicarbonate ion in the liver. That is how they manage the metabolic acidosis. Then the treatment for metabolic acidosis, intravenous administration of lactate solution, regular insulin to reverse the diabetic ketoacidosis, and intravenous bicarbonate to correct the acidosis, and fluid replacement, dialysis for drug toxicity, and antidiarrheals. Next is the metabolic alkalosis. Metabolic alkalosis in the sense that is just opposite to the metabolic acidosis. That is bicarbonate level excess over there. Here the concentration of blood is greater than 26 milliequivalent per liter. Already I said the normal range is 22 to 26. So when it is exceeds 26 milliequivalent per liter, that is it is excess of bicarbonate level. So the main causes like excess vomiting, that is loss of stomach acid, excessive use of alkaline drugs, certain diuretics, endocrine disorders, heavy ingestion of antacids, and severe dehydration. Then compensation for metabolic alkalosis. The alkalosis most commonly occurs with the renal dysfunction. So we cannot count on kidneys for that. Then respiratory compensation is difficult. That is hyperventilation limited by hypoxia. So in the picture we can identify that as it is previous explanation, the first aspect metabolic balance is 1:20, that is carbonic acid as well as bicarbonate ions. The metabolic alkalosis, that is uh, um, bicarbonate ions increase because of loss of carbon chloride ions or excess ingestion of sodium bicarbonate. So in the picturization you can identify the carbonic acid is as it is normal 1, but whereas normally the ratio of 20 is bicarbonate, here it is increased to double to 40 level. So the changes, what are the changes? The pH level will increased. Partial carbon dioxide level, there is no change in partial carbon dioxide. That is a thing we supposed to look. The metabolic comes, the changes will be pH as well as the bicarbonate level. Here the bicarbonate level is increases. Okay, then body's compensation is breathing suppressed to hold the carbon dioxide. To compensate that, here what does kidneys do? Kidney conserve H plus ions and eliminate the bicarbonate in alkaline urine. So the treatment as it is shows we have to administer chloride containing solution. So these bicarbonate ions will be replaced by chlorine ions. The symptoms of metabolic alkalosis are respiration slow and shallow, that is why to hold back the carbon dioxide. Then hyperactive reflexes, tetany, often related to depletion of electrolytes. Then atrial tachycardia, dysarrhythmia. Then treatment for metabolic alkalosis, electrolytes to replace those lost. Intravenous administration of chloride containing solution. Treat underlying disorders. We are supposed to identify what is the exact factor. If it is a renal disorder or respiratory or any kind of GI disturbances, whatever it is, we are supposed to treat the condition. So this is in a nutshell. I just put what is the respiratory acid-base imbalance. In this slide, you can see respiratory acidosis and respiratory alkalosis. So what is respiratory acidosis? That is hyperventilation and excessive carbon dioxide production. Here it is a hyperventilation. So carbon dioxide, that is a stagnation. Then, so what is the definition is already is a repetition. Definition is given here. Then causes also mentioned. What are the clinical manifestations and what are the laboratory findings and what is the management for respiratory imbalances. That is respiratory acidosis and respiratory alkalosis. And here we can see metabolic acidosis and metabolic alkalosis definition, causes, clinical manifestations, laboratory findings and management. I hope you understand about the acid-base imbalances, especially respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. Thank you.